Good morning, everybody. Today I'm here with Dr. Lucy McBride. It's kind of, I hope, full circle, although maybe a little early for full circle, but we met Dr. Lucy McBride at the beginning of the pandemic. And now here we are with, I would say there's a light at the end of the tunnel. Do you feel that way?
Absolutely, yeah.
All right, so we're back, and what we're going to talk about is reentry. What does reentry look like for us and our kids? Also, you started a daily newsletter, right? When the pandemic began, and it grew and grew and grew and grew. And then it became a little harder to do daily. So now I think you're doing twice a week. And for people who are listening, you should sign up because it's really deep insight into what's going on right now, great up-to-date advice. And how can they sign up for your newsletter?
Thanks, Sue. I appreciate that. So you can sign up on my website, which is my name, www.lucymcbride.com. You can look at all the old newsletters and then sign up for the incoming newsletters I put out twice a week. Yeah, basically a year ago, you remember, right? I mean, how could you not remember the kind of hair on fire days, right? Of oh my gosh, we have to completely pivot our entire lives to a virtual existence, lockdown, rationing toilet paper. Back in March 2020, it was clear to me that people were starved for real-time, facts-based, unbiased information and guidance. So I started writing a newsletter to my patients to help them navigate their day-to-day existence because I couldn't pick up the phone fast enough to answer all the questions. And so I started putting that out. And then I wrote every day for 90 days. And then now it's twice a week. And now I have 10,000 readers. I got an email this morning from someone in Nairobi, an email last night from someone in Argentina. And I actually put a piece in the Huffington Post on Tuesday. The Huffington Post published my article about the mental health toll of the pandemic. You and I talked about this before, and I've been talking about this for now a year, that the pandemic is a crisis of physical health, right? It's a virus that's lethal potentially and affects, can affect everyone, but it's also a pandemic of mental health in crisis. No one is immune to the trauma of the pandemic. No one, I mean, if you haven't noticed that you're under a little more stress and you have maybe more anxiety, then that would be a little bit unusual. In other words, grief, trauma, loss, feelings of anxiety, feelings of worry, feelings of vulnerability are normal and part of the human condition. So, I'm trying to name it and normalize it and then help people navigate the mental health component in the context of their physical health, because, ultimately health is born when we marry mental and physical health together, when we think about them in concert. And ultimately health in the pandemic is achieved or optimized when we marry public health advice that's broad and general with nuanced individual advice that in my office is about your medical evaluation and your mental health together. And so right now, when we're facing reentry, we're facing a real transition point, right? It's almost easier to nothing's been easy in the pandemic, just to be clear. I'm just saying it's almost easier when you're given strict lockdown rules, right? It's like lockdown, don't go anywhere, and then, but right now we're in that gray area where decisions have to be made and behaviors can and should be changed as we evolve with more people being vaccinated. But when there's change, when there's transition, that brings anxiety. And how do we manage that?
Okay, so let me just put out there for everyone listening that put your questions in the comments and we'll get to them. We're going to do a little just of dumping information on you first, and then we'll get to all the questions. So Doris, we see your question. We'll get to it soon. But I want to start by asking you, Lucy, what are the guidelines? Let's start with the physical health part of this. And I love how you talk about marrying physical and emotional health. And I think if you've got a teenager at home, most of us know this has been so challenging, and hopefully the message has gotten out that you're not alone. So we're going to have to now figure out, how do we dig ourselves out of this? It's not like it's over and done. It's over and now we have so much else to think about. So Let's start with the physical. As vaccinations are becoming more available, Does that change your recommendations as a society for us or as individuals for us?
Absolutely. I mean, the CDC is supposed to announce today what is quite obvious to anybody who's in medicine or public health, that people who have been vaccinated against COVID-19 by one of these three miraculous vaccines that basically take death and severe disease off the table, vaccinated people can be together unrestricted without masks indoors. We should do that. That is the point of vaccination. And so the CDC is going to say that officially. It's sort of like, in my opinion, not to be fresh, but it's sort of like saying the sky is blue. Vaccinated people are not at risk of infecting each other. I mean, the risk, is it zero? No, but the risk of walking out your front door isn't zero. Nothing in life is zero risk. But these phenomenal vaccines have taken death, severe disease off the table, and have created a scenario where once you've been vaccinated, you have a tiny, tiny risk of getting a mild cold or a mild flu. And
that's for all three. And that's for all three.
For all three. For all three. They're all phenomenal. And so, we live with that risk every day. So if you have 2 vaccinated people, 3 vaccinated people, a household full of vaccinated people, or mixed people who are different households who have all been vaccinated, the risk of infecting one another and sickening other people, all within vaccinated people, is as close to zero as you can possibly get. Are there going to be exceptions? Will variants continue to emerge as we give the virus longer and more opportunity to mutate? Yes, but right now the vaccines all cover against the variants. So this is what I was writing about in the piece I put out in the Huffington Post on Tuesday, is that one of the ways we mitigate anxiety and one of the ways we can help our teenagers is to follow the facts. So if we listen to these sort of absolutist and inflammatory headlines like, oh my gosh, the variants are here, and then it keeps us from socializing with vaccinated people once we're vaccinated, then that's an anxiety problem. And so parents need to understand that, when they're vaccinated, they can get together with other people. Now, let me just say this and be clear. The kids are not vaccinated yet, right? The kids haven't been vaccinated because the vaccines are only approved, 2 of them for 18 and above. Pfizer is for 16 above, but most kids aren't in the priority groups to be able to get the vaccine right this minute. But I also want to say this. When people around the kids are vaccinated, so when the teachers in the schools have been vaccinated, when the parents have been vaccinated, when the grandparents have been vaccinated, that protects the kids as well. So one of the questions I'm getting every single day, I mean, all day long, is, okay, my grandmother has been vaccinated, or if you're someone my age, my mother has been vaccinated, maybe the parent has been vaccinated. What about getting together as a group, as a family? Can we plan a trip this summer with a teenage kid or kids with parents who may or may not have been vaccinated and the grandparents have been? The answer is this. I cannot tell you what to do. My job isn't to tell you how to behave. My job is to tell you the facts, to tell you the science, to help you understand your risk tolerance, and then to make healthy decisions for yourself. The fact of the matter is that the vaccinated grandmother is not going to die, not going to go to the hospital, and has a tiny chance of getting coronavirus at all. And if she does, it would be a mild respiratory illness that we all had 100 times in our lives. So she's fine. We also have enough data right now, which is why the CDC is, we have, in my opinion, adequate data to say that the risk of transmitting the virus to other people, like can grandma carry the virus in her nose in enough of a quantity to then sneeze it into someone's air and breath and hurt someone else. This is probably the biggest public health debate right now, and it explains my Twitter addiction, because there's brilliant minds kind of battling it out on when do we blow the whistle and tell the general public that the data is clear and abundant enough that transmission is reduced. Transmission is never going to be reduced by a vaccine. You can't sterilize somebody with a vaccine. That's biologically impossible. But what my point is that there's nuance here. And when you are desperate to see your parents, grandparents on a trip, when you're desperate as a teenager to open up your life a little bit more, the parents need to understand that risk is very reduced when the kid is surrounded by vaccinated people, and that's in school, and that's also in their personal lives. One of the ways,
and we're taking
is that one of the ways the kids, kids, their job is to go to school. Their job is to socialize. That's what they do. And so we need to allow them to do that, but with facts and science, under our belt.
And still knowing that getting in a car every day has risks as well. So we can't, we can't eliminate all risk in life. Now, I want to ask you a few practical questions. There's some information that may or may not be true out there. So taking painkillers before you get the vaccination, does that impact the efficacy?
So you just don't do that. There's no reason to take a painkiller before you get vaccinated. I got both of my shots. I had my arm hurt maybe a couple hours later, but like you wouldn't want to take a pain pill when you don't have pain. So don't do it.
So just don't. There's no reason to.
Just don't. Okay. You can take Advil or Tylenol after the shot as long as you have no reason not to. Like my patients who've had stomach ulcers, for example, can't take Advil. But there's no reason to pre-medicate. That would be an anxiety-driven decision to do that.
Okay, and if you've had COVID, and this is one of the questions we got, do you need the vaccine? Are you good?
Yeah,
and
you do.
And you do need the vaccine, and then this is myth or truth. Are you potentially going to have a stronger reaction to the vaccine because you've had COVID?
So those are great questions. So how do we become immune to COVID-19? One is by getting the vaccine. One is by getting the illness, right? It's not that I recommend getting the illness to become immune, but if you happen to have had COVID and you recovered, and you're one of the lucky people who recovered fully, you have an immune response that is durable. We don't know how long that immunity lasts because remember, we're watching this whole thing play out in real time, but probably at least 8 months. But could you go to South Africa, inhale the South African variant and get COVID again? You could, but the immunity that you get from having had COVID-19 is robust. That said, you should get the vaccine because we're about to get rained on with vaccine doses. It's going to be more widely available. I wouldn't cut the line. I mean, I wouldn't cut the line ever, but I wouldn't, you don't have to rush to get it because you do have some immunity. People who have had COVID itself, the disease, who get the vaccine, some people are having more of a reaction because it's basically like a booster, right? It's boosting your immune system's ability to, keep coronavirus, out of your life. And there's actually emerging and mounting data to show that we probably can give people who've had COVID only one shot and not need the second one. But the fear of the side effects is real. But I want people to understand that most people have, a sore arm, a little body aches or mild achiness, and that go away readily with Tylenol or Advil. And so, and remember what we're getting with the vaccine. We are getting protection against death, severe disease, and hospitalization, and the ability to open up our lives.
Okay, so this one, rumor, truth. Has there been a negative effect on men and fertility? And is that something?
Myth. It's a myth. It's so sad. I mean, half of my job these days is dispelling myths. There's so much information. As you know, everyone has a megaphone right now. There's so much mythology, so much misunderstanding and confusion, even in highly educated, smart patients and people. That is a myth. It does not cause infertility in men or women. It's sad to me. It's suppressing vaccine uptake in childbearing aged women. That fake. I don't want to say fake news because that's just so. It has a chart. It has like a political. There's just nothing political about this pandemic. So I would just say that's a myth. Do we have more to learn about the long-term safety of the vaccines? Absolutely. Like they are going to be studied for decades. But there's no plausible biological reason why it would have any downside on, for example, pregnant women, nursing women, and it would have no effect on fertility. At the same time, it needs to be seen. But to say that it causes infertility is completely inappropriate and incorrect.
Okay, so I just want to recap what you were saying so we can distill it down. If your kid is, of course, our kids are desperate to see their friends. So are you loosening up on that? Are you saying?
So I'm not saying, okay, now your kids can go run free and hang out with all of their unvaccinated friends. I'm saying that in the right conditions where you've decided that the benefits outweigh the risks, I think it's okay to start liberalizing a little bit. For example, on a family trip where grandma is immune and the parents may be immune because they're of age and they've gotten the vaccine and the kids aren't. Like, the risk to the kids is very low. The risk to the kids in school when the teachers have been vaccinated, when you surround the kids by vaccinated people, they're safer. But the science hasn't changed. Unvaccinated people hanging out with unvaccinated people is still the problem and the reason we have community spread ongoing. So, for example, in Texas, right, we're going to have, we're going to naturally have increases in cases because when you liberalize the rules, that's how the virus spreads. The virus loves that opportunity. So when people who are unvaccinated get together, they still need to have complete, aggressive risk mitigation elements in place, masks, distancing, et cetera. But it's also important to realize, like, the weather is getting nicer. Outdoors is 20 times safer than indoors. Let the kids be outside with their friends, distance and masked. There's a lot you can do outside, even in the cold. But the kids really need to socialize with one another, and they really need to, but also need to know that they are at risk of getting sick. Remember, however, also that, and this is not me saying, let your guard down by any stretch of the imagination. I've had patients in the ICU. I've been seeing COVID patients for a year. It's a serious, deadly disease, and we don't want to let down our guard. But what I'm trying to say is we want to marry we want to consider your emotional health in the context of the risk that you have. Kids do much better with COVID-19 than adults do. The risk of MIS-C, that inflammatory condition that is so scary and naturally so, is 1 in 10,000. So again, I'm not saying unmask your kids and let them go socialize for the sake of their jollies. I'm saying that you want to know what the risks are and know that the risk of a kid getting very sick and dying or getting MIS-C is low. And so if they're around other vaccinated people, or if they're outside, they're probably going to be okay. But again, my advice is not a substitute for, the pediatrician's advice or, specific medical advice. My role in this public-facing thing that I'm doing is to help people, find the facts and make smart decisions to protect them from COVID-19 and from the despair that the pandemic has brought.
Okay, this is a good transition for our first question. Doris wants to know, how can I help my teen get help if she doesn't even think she needs it? She thinks no one else can help her.
Yeah. So the first thing to do is, normalize it, and name it. So, like, I have 3 teenagers. I'm a mother as well. So I commonly talk at the dinner table. My kid's kind of grown at this point. I'm like, look, this is a hard time for all of us. It would be so unusual to not feel distressed or blue that you're not seeing your friends. Like, how sort of normalize it, empathize, and name it and say, look, everyone's going through a stressful time, and it's particularly stressful for you, honey, because you need your social life. You need to be in school. That's what kids do. And I empathize, and then say, look, seeing someone to get some help for it, like seeing a therapist, isn't because you're mentally ill or because you're broken. It's really to have a coach to help you navigate all the different thoughts that you have and all the different transitions that are going on in your life. And, it would be something that could really help you, sort of like you have a coach in soccer or a coach in, basketball to help you, practice your skills. And learning stress management skills it takes work. It takes adults sometimes their whole lives. So naming it, normalizing it, and then, being vulnerable yourself as a parent, saying, look, I've struggled. Sometimes I don't sleep well. I miss my friends, that kind of thing.
That's excellent. Okay. So Shannon, this is such a tough question because I think lots of people are going to be experiencing this with their kids. Her kid is anxious to go back to school.
Yeah,
anxious in a bad way, not an excited way, like scared to go back to school.
Yeah. No, and we're seeing that. I'm seeing some of my adolescent patients who, some of the kids in the pandemic have actually, quote unquote, enjoyed the lack of social pressure, the lack of academic pressure, you know, and have, you know, kids who are introverted or have some social anxiety, which, let's face it, what kid doesn't have some social anxiety? High school, middle school, it's hard socially. So going back to school, it can be scary. It means you have to ramp up. It means you have to wear a mask and sort of be engaged. So, you know, I think in the same vein that I was just talking about, you want to say, look, it's hard. Like, I mean, we have gotten so used to this virtual existence. It's going to be hard, but just remember that it's going to be hard for everyone, and that the teachers know that it's hard, and they're going to be having a hard time transitioning into in-person teaching. And so, you know that you're in this with everybody else, and just take it one day at a time. And the other thing I would say is this: give your kids the opportunity to have a conversation about what are they doing and what can they start doing to help manage their anxiety, from, you know, taking a walk outside, a couple brisk laps around the block, you know, getting outside in nature, doing like a family hike on a weekend, you know, allowing them to see their friends if they're outdoors and masked, and, you know, doing the things that they should do to protect themselves when they haven't had the vaccine. And then, you know, suggesting therapy if someone's really anxious, because therapy is a way to not have to have the parent, you know, be the you know, therapist, but also to give the kid, you know, some real strategies in a safe space.
Okay. Now, is there like a place you can suggest people can go to find out when they're eligible and how they can get a vaccine?
Well, so I'm telling my patients, some of whom are adolescents, to register on, you know, the whatever, you know, in the districts, like the dc.gov site, or wherever, you know, Montgomery County, Fairfax County, whatever county website you can. And then if you've been a patient, either, you know, you don't have to have been in the hospital, but even an outpatient, like if you've had a radiology study, like, you know, you had an x-ray of your chest, for example, at a local hospital, put your name on that list as well, because you might get an email saying, hey, now that you're eligible, you can get the shot here. So basically, I'm telling people, cast a wide net.
Do you think that at some point there, like schools, for example, Christine wants to know this, and I think generally, like, before you get on a plane, are you going to have to show that you've been vaccinated, or before you go to school, will the schools can they make it mandatory?
I mean, I don't know. I mean, you know, we do that, right, with schools now. I just had my kids see their pediatrician, and he has to sign off on, you know, certain things that they've gotten, or you have to have a religious waiver to say why you can't get vaccinated against, say, you know, measles, mumps, rubella. Will that happen for COVID? I don't know. That is not, who knows?
Too soon to tell.
Too soon to tell. I mean, that's up to the policymakers. I mean, you can make an argument for both ways, right? There's like personal liberty of like not getting the vaccine, but then there's also like public responsibility of being vaccinated. So not only you're protecting yourself, but protecting other people. So, you know, I'm encouraging every single person I know, I see, I speak to publicly, get the vaccine. The only reason you shouldn't get the vaccine is if you have anaphylaxis to one of the components of the vaccine, the polyethylene glycol. And even if you have that allergy, you can still get the vaccine. You just would want to talk to your doctor about it. So there's no reason not to get it. It does not cause infertility. The side effects are manageable, and the upsides are enormous.
Masks. So it's our masks, and in general was, I think, reflective of like the tension that people feel around how someone else behaves.
Yeah.
Because the story here wasn't just about me. It's like, if you're not wearing the mask, you're putting me and my family in more danger. So right now, and as this continues, we're all supposed to still wear masks, because we don't have like stickers that say I've been vaccinated or anything like that. How's that going to work for our kids? There's so much social pressure.
So there are a number of questions there in one. First of all, I'll say that, so there are two goals of the vaccine, right? One is to protect yourself from getting COVID. The other is to protect other people. And we're finding, as I said earlier, that the risk of transmitting virus is reduced greatly when you get vaccinated, the risk of transmitting it to other people. Similarly, there are two goals of the mask: to protect yourself and to protect other people. So we are in a moment right now where the population is being blanketed slowly with vaccination, which then is going to allow people who have been vaccinated to not wear a mask in the privacy of their home with other vaccinated people, whether it's 2 people or 5 people or 10 people. The problem is not everyone's going to be vaccinated right away. So we have to understand that the pandemic does not have an on-off switch, right? So until people have been vaccinated enough that we call it herd immunity, where the virus just doesn't have enough people to bounce off of, we need to mask in public. Even if you're vaccinated, you still need to wear a mask in public because there's no like tattoo on your forehead that says you've been vaccinated. Moreover, it's, we want to stand in solidarity with people who haven't been vaccinated, but, separately, the risk of transmission isn't zero once you've been vaccinated. But at some point, this is an evolution. It's not going to be it's not going to be like an off switch. It's going to be like an off ramp. And over time, as we achieve herd immunity, we will be able to tell people you don't need to wear a mask if you've been vaccinated, if you're outside and, living your life. But if you haven't been vaccinated and you want to protect yourself, you still need to. Does that make sense? So it's all about where you are. Are you in public or in private? Have you been vaccinated or not? And then your own unique health conditions, and then your, sense of public responsibility, which of course I hope is high for all of us.
So let's take this just down to this one question from Stephanie, which is her kid is wearing the mask and his friends are making fun of him and they're not wearing the mask. So in this sphere of how do we arm our kids to face situations where not everybody's doing what you're doing?
Yeah, I mean, that is like the $1 million question of like teenager dumb, right? Is like how not to succumb to peer pressure, which, is ubiquitous in general. And then in the pandemic, is even harder. Your kid who's wearing a mask around unvaccinated people and who is probably unvaccinated, him or herself, is the right thing to do. So, that's just about your kid being reminded that is the right thing to do. But you also, if you're outside and you're distanced from someone 6 feet and you're consistently distanced from that person and they're like throwing a football together, they don't need to wear masks.
Okay. Well, so much great information, a lot of nuances here that, we would all really prefer to just have the right. Yes and the no, and that's right. Not the way this is going down. But you really illuminated so much information here, and we're really grateful for having you once again, Dr. Lucy McBride. Thanks so much for being here with us.
Thanks so much. Thanks, Sue. Appreciate it.